Charles Cullen is one of the most notorious serial killers in modern history, known for his chilling crimes as a nurse. Over the span of 16 years, Cullen worked at various hospitals across New Jersey and Pennsylvania, quietly killing at least 40 patients, though some estimates suggest the true number could be much higher. His case is particularly disturbing because of the position of trust he held as a healthcare professional, the very person who was meant to heal, not harm. Cullen's ability to exploit his access to powerful medications, combined with the failures of the healthcare system to properly investigate suspicious deaths, allowed him to evade capture for years. His story is a tragic tale of manipulation, missed warning signs, and the devastating consequences of institutional neglect. Charles Cullen was born on February 22, 1960, in West Orange, New Jersey, the youngest of 8 children in a troubled family. His father died when Cullen was just 7 years old, and his mother struggled with mental health issues. Growing up in such an unstable environment deeply affected Cullen, and his early years were marked by a sense of isolation and social awkwardness. He was described as shy, introverted, and often the target of bullying. His academic performance was inconsistent, but he was known to be intelligent, especially in subjects like science and math. However, his emotional struggles, including severe depression, led to a lack of confidence and an inability to form lasting connections with others. Cullen's nursing career began at St. Barnabas Medical Center in Livingston, New Jersey. At first, he appeared to be a competent and dedicated nurse, but soon, a disturbing pattern began to emerge. His patients, particularly those in critical care or elderly patients, would unexpectedly die under his care. Some of his colleagues noticed the frequency of these deaths, but did not have the evidence to connect Cullen to them. In many cases, the patients were already gravely ill, which made it easier for Cullen to cover his tracks. He gained access to powerful medications like digoxin and insulin, which he used to kill his victims. Cullen's modus operandi involved injecting his victims with lethal doses of these drugs, causing heart failure or insulin shock, because the deaths were often caused by medical complications that were difficult to trace. Cullen's actions went largely unnoticed. His ability to slip under the radar at different hospitals was aided by his quiet demeanor and professional competence. His co-workers saw him as a dedicated nurse, though they were puzzled by his lack of personal connections with other staff members. Cullen was emotionally distant and had difficulty forming relationships, which was another red flag that went largely unexamined. As he moved between various hospitals, including Morristown Memorial Hospital and Somerset Medical Center, the pattern of unexplained deaths continued. Cullen's access to vulnerable patients in intensive care units and his knowledge of medication allowed him to commit his crimes without raising suspicion. Over time, the number of deaths connected to him grew, but without a coordinated investigation, Cullen's actions remained hidden. Cullen's crimes finally began to unravel in 2003, after he had been working at Somerset Medical Center for several years. A nurse at the hospital, suspicious of Cullen's behavior, reported an unusual incident involving a patient who had died after being administered a high dose of digoxin. This tip led to an internal investigation that would eventually expose Cullen's deadly actions. During the investigation, hospital staff began to realize that Cullen had been involved in multiple unexplained deaths. The police were called in, and Cullen was arrested on December 12, 2003. When questioned, Cullen confessed to killing at least 40 patients over the years, though he claimed that the actual number could be much higher. He explained that his motivation was not anger or revenge, but rather a need for control. Cullen described how he enjoyed the power he felt when deciding who would live and who would die. He also admitted that he often killed patients who were already near death, making it harder for doctors and nurses to suspect foul play. Cullen's lack of empathy and his detachment from the suffering of his victims were key elements of his psychological profile. Charles Cullen's trial began in 2006, where he was charged with multiple counts of murder and attempted murder. Cullen pled guilty to the murders of 22 patients, but investigators believed the true number of victims could be as high as 400. In a statement, Cullen's defense team described him as a man who had struggled with deep depression for most of his life, and they argued that his actions were driven by a psychological condition rather than malice. Ultimately, Cullen was sentenced to multiple consecutive life sentences without the possibility of parole. The case highlighted significant flaws in the healthcare system, particularly the lack of communication and coordination between hospitals. Cullen had moved between numerous hospitals without any of them raising alarms about his suspicious activities. The case also raised questions about the screening and oversight of healthcare professionals, particularly those working in high-stakes environments like intensive care units and emergency rooms. The story of Charles Cullen has had a lasting impact on the healthcare system. His case revealed the vulnerabilities in hospital practices and the need for better tracking of suspicious deaths. Many hospitals were criticized for their failure to investigate the high number of patient deaths in which Cullen was involved. As a result, hospitals across the country have implemented stricter protocols for monitoring and investigating unexplained deaths, as well as more rigorous background checks for nurses and other healthcare professionals. Cullen's case also led to greater awareness about the potential dangers posed by individuals in positions of trust, especially in the medical field. It underscored the need for vigilance, better training, and improved communication between healthcare institutions to ensure that similar tragedies do not occur in the future. Charles Cullen's case is one of the most disturbing examples of a serial killer exploiting his position to kill over a prolonged period. His ability to evade detection, despite the numerous warning signs, is a testament to how systemic failures can enable horrific crimes. The legacy of Cullen's actions is not only a reflection of his own dark psyche, but also a cautionary tale for the healthcare industry and society at large. His story remains a chilling reminder of the dangers that can arise when trust is betrayed by those entrusted with the most vulnerable lives.
Charlie, what we'd like to first bring up, the first instance we'd like to bring up with you, you understand you've been charged with 2 crimes, correct?
Murder and attempted murder.
Murder and attempted murder. Do you understand, or do you know who the victims of both those charges refer to?
I do